What is the first step in the pediatric BLS sequence for a collapsed child? A. Check for a pulse. B. Give 2 rescue breaths. C. Activate the emergency response system. D. Check for responsiveness. Answer: D. The first step is to check if the child is responsive before proceeding with further assessment. What is the preferred method to open a pediatric airway when trauma is not suspected? A. Jaw thrust maneuver. B. Chin lift maneuver. C. Head tilt, chin lift maneuver. D. Head tilt only. Answer: C. Head tilt, chin lift is the preferred technique for opening the airway unless trauma is suspected. The compression-to-breath ratio for rescue CPR in a child is A. 15:2. B. 30:2. C. 10:1. D. 20:2. Answer: A. For children, the recommended compression-to-breath ratio with 2 rescuers is 15 compressions to 2 breaths. What is the most reliable method to confirm endotracheal tube placement in a child? A. Bilateral chest movement. B. Auscultation. C. End-tidal CO2 monitoring. D. Condensation in the tube. Answer: C. End-tidal CO2 monitoring is the gold standard to confirm proper endotracheal tube placement. Which rhythm is most commonly associated with sudden cardiac arrest in children? A. Ventricular fibrillation. B. Bradycardia. C. Pulseless electrical activity, PA. D. Asystole. Answer: C. PA is the most common rhythm in pediatric cardiac arrests due to respiratory failure or shock. What is the recommended depth of chest compressions for infants during CPR? A. 1 inch. B. 1.5 inches. C. 2 inches or 5 centimeters. D. 1/3 the chest depth. Answer: D. Compressions should be at least 1/3 the anterior-posterior diameter of the chest, about 1.5 inches in infants. Which drug is first line for treating bradycardia in a pediatric patient with poor perfusion despite oxygenation? A. Amiodarone. B. Epinephrine. C. Atropine. D. Lidocaine. Answer: B. Epinephrine is the first-line drug for symptomatic bradycardia in children. What is the proper shock dose for defibrillation in a pediatric patient? A. 1J/kg. B. 2J/kg initially. C. 4J/kg initially. D. 10J/kg. Answer: B. The initial defibrillation dose in children is 2J/kg, increasing to 4J/kg if needed. What is the maximum volume for a fluid bolus in a pediatric patient with septic shock? A. 5 milliliters per kilogram. B. 10 milliliters per kilogram. C. 20 milliliters per kilogram. D. 50 milliliters per kilogram. Answer: C. A 20 milliliters per kilogram isotonic crystalloid bolus is standard in pediatric septic shock management. Which sign is an early indicator of respiratory distress in children? A. Bradycardia. B. Cyanosis. C. Nasal flaring. D. Unresponsiveness. Answer: C. Nasal flaring is an early sign of increased work of breathing in children. What is the initial management step for a child with an upper airway obstruction and stridor? A. Start chest compressions. B. Administer antibiotics. C. Provide humidified oxygen. D. Intubate immediately. Answer: C. Humidified oxygen can help ease upper airway obstruction while further assessment continues. A child with hypotension, cold extremities, and delayed capillary refill likely has A. Distributive shock. B. Obstructive shock. C. Hypovolemic shock. D. Cardiogenic shock. Answer: C. These are classic signs of hypovolemic shock, commonly due to fluid loss. The most common cause of cardiac arrest in infants and children is A. Ventricular fibrillation. B. Trauma. C. Respiratory failure. D. Seizures. Answer: C. Respiratory failure is the primary cause leading to cardiac arrest in pediatric patients. What is the correct ventilation rate for an infant with a pulse during rescue breathing? A. 1 breath every 3 seconds. B. 2 breaths every 15 seconds. C. 1 breath every 6 seconds. D. 20 breaths per minute. Answer: A. Give 1 breath every 3 to 5 seconds for infants and children with a pulse. What type of shock is characterized by warm extremities and bounding pulses in its early phase? A. Cardiogenic shock. B. Hypovolemic shock. C. Distributive shock. D. Obstructive shock. Answer: C. Distributive shock, especially septic shock, may present with warm extremities initially. When should chest compressions be started in a child with a heart rate less than 60 bpm? A. Only if breathing is absent. B. If there are no signs of cyanosis. C. If the child is crying. D. If perfusion is poor despite adequate oxygen and ventilation. Answer: D. In children, compressions are indicated if HR less than 60 bpm with signs of poor perfusion despite ventilation. In PALS, which of the following is an indication for synchronized cardioversion? A. Ventricular fibrillation. B. Pulseless bradycardia. C. SVT with poor perfusion. D. Asystole. Answer: C. Synchronized cardioversion is used for unstable supraventricular tachycardia, SVT, with poor perfusion. A capillary refill time greater than 2 seconds in a child suggests A. Good perfusion. B. Increased oxygenation. C. Poor perfusion. D. Adequate fluid volume. Answer: C. A delayed capillary refill time suggests decreased peripheral perfusion. What is the most important assessment tool in the PALS primary assessment? A. Pulse oximetry. B. The ABCDE approach. C. Glucose check. D. Chest X-ray. Answer: B. The ABCD, airway, breathing, circulation, disability, exposure, approach is central to PALS assessment. What is the correct ratio of compressions to ventilations for single rescue or CPR in a child? A. 30:2. B. 15:2. C. 20:2. D. 5:1. Answer: A. A single rescuer performs 30 compressions to 2 breaths for children, same as adults. What is a normal pediatric systolic blood pressure for a 4-year-old? A. Less than 60 millimeters of mercury. B. Around 50 millimeters of mercury. C. Greater than 70 plus, age times 2. D. Always 100 millimeters of mercury. Answer: C. The lower limit of normal systolic BP is 70 plus, 2 times age in years. When delivering a shock with a manual defibrillator, you must ensure A. The pads are wet. B. Oxygen is being delivered. C. No one is touching the patient. D. The child is breathing. Answer: C. To prevent accidental shock injury, ensure everyone is clear before delivering a shock. What is the primary cause of bradycardia in pediatric patients? A. Hypertension. B. High oxygen levels. C. Hypoxia. D. Fever. Answer: C. In children, bradycardia is commonly caused by low oxygen levels. Which of the following is an appropriate method to assess the airway in an unresponsive child? A. Check carotid pulse only. B. Watch chest rise and fall. C. Tap foot and shout. D. Insert airway blindly. Answer: B. Observing for chest movement is key to assessing airway patency. What is the priority when managing a child with severe anaphylaxis? A. Give 4 fluids. B. Administer epinephrine. C. Apply cold compress. D. Start chest compressions. Answer: B. Epinephrine is the first-line treatment in severe anaphylaxis.